So the event today was an opportunity to come together to discuss the challenges and opportunities around healthcare workforce development.
A real focus on workforce, on our professions in healthcare, and what we can do to make sure we get sufficient professions and that they are kept well in their careers.
It's been a great opportunity here at Northumbria University in the clinical skills environment to actually get together with like-minded practitioners, policy makers, educationalists, to actually really think about workforce development and how we can actually all work together to make a real difference to the healthcare of the future.
We had a few keynote speakers today from varied backgrounds, and I think they all presented slightly different perspectives on what is a really quite a complex problem within healthcare at the moment.
We need the government, whoever that ends up being, to urgently address the growing shortfall in healthcare educators and researchers, both in practice and in universities. We need a boost in healthcare student recruitment and retention as an absolute priority. You all know that, we all know that, we need the ministers to know that as well.
The space we're trying to create in an equitable world is one in which people feel that they are confident and competent to ask the questions, to adapt their practice, to think about the intentions, and to help and support themselves and other people to give the best that they can.
Now, reform often scares people. People think, oh, it's a race from the bottom, we're trying to do things on the cheap, we're trying to get away with it. So I just want to be really super clear that actually things like registered nursing degree apprentices, we need to reform how they work, because actually we're not maximising the opportunity they give us. So whether that's through funding, whether that's through levy reform, there's work that we would be doing to do that. But there's also the nature and experience of change that we're things. The how we train people for the future is really important.
My key takeaway is people seem really concerned about the workforce at the moment and committed to doing something about it. So there's a sense of wanting to find a solution or a range of solutions and really supporting the pipeline for the future healthcare workforce.
There's no quick fix. I think there's lots of different things that we could and we should be doing to try to address those problems. And I think that's going to be a long-term solution as well.
So it's fantastic to hear that passion from all the different people today present. And I think that's really important to make sure that we would recruit for the profession. We've got to think about different ways to recruit, getting young people, widening access agendas, but actually we need to just change that conversation and actually become part of a bigger journey in relation to like a health career.
We have a lot of students that very open and honestly come out and speak to our staff to state that they are never going to work for the NHS. Have we planned and looked at that percentage of people?
So the student outcomes data is collected for all students who study in higher education, but it lags behind because it's done by HMRC. The other thing we do at Northumbria is we do a career readiness survey of all students at the start of each academic year. So that data exists. Some of it's publicly available, like the graduate outcomes data, but the career readiness stuff, because it's an amalgam, and you can drill it down by department, by programme, etc. I'm sure we can share that with partners easily enough.
Events like today's event are really, really important because often, particularly in a university setting, we focus on the teaching and the learning, and we don't really often have opportunities to stand back and reflect on why we do what we do, and to give the students, our stakeholders and our partners chance to join in conversations with us to work out how best we can go forward in the future.
Chase has got a broad aim and 4 key areas: tackling health and social inequalities, looking at public policy around health and social care integration, amongst other things, workforce development, which is the theme for today, and also looking at translational research. And we've already got a number of research experts in that kind of area around the implementation science kind of area. Northumbria is a leading regional provider of health professionals for the future, and many of you in the room are our partners in the NHS organisations. and in care homes, etc., who help us support the development of that workforce. So in pre-registration, this is roughly about the completions per annum, 600 plus, not including apprenticeships for nursing, 189 plus for allied health professionals, around 81 for midwifery and around 103 for social work. So in terms of growth, we have done the long-term workforce plan modelling to 2030, and we're going to increase by around about 8% a year. We are currently working on the approval of a nursing associate programme, but we have a nursing top-up, occupational therapy, social work and operating department practice apprenticeships. We have done research work around retention, particularly around staff well-being, and we've got work to improve continuation and progression. In terms of reform, we have developed a number of advanced clinical practitioner pathways. The blue ones are currently going through approval system, and then we've developed a suite of primary care programmes, and because of various regulations we've actually had to approve 32 programmes, which was no mean feat. So we've reapproved health visit and district nursing. We have approved community children's nursing, both as apprenticeship and standard delivery, general practice nursing, and we are the first institution in the UK to develop the adult social care specialist practitioner programme.